Boy, chronic pain can be miserable, but instead of increasing your dosage of pain medication, some people can take less medication but have it go directly to the source of the problem. Here with more on that is Dr. Ali Narizi with Nevada Advanced Pain Specialists. So glad to have you back on the newscast. Thank you.
Thank you so much for having me back.
How does this drug pump work?
So the pain pump is an implantable infusion system which directly sends the medication into the site of action, which is the spinal cord and the cerebrospinal fluid. So what happens here that there's receptors right over the spinal cord, and medication goes directly there, binds to those receptors, and provides a relief to the patient.
Which means maybe less is needed because it doesn't have to travel through the GI tract and bloodstream and all that.
That's true. What happens when you have pain, you take the medication by mouth, it goes through your gastrointestinal system, gets into your bloodstream. For bloodstream, it needs to get into your spinal cord. Yeah. So guess you have to have too much of the medication in your bloodstream to get to your spinal cord, so that increases the side effect. Now you can just bypass the whole system. You can just go directly into the spinal canal where the receptors are and just give a little bit of medication.
Wow.
And that can provide significant relief to the patient. Plus, there's not much of systemic absorption, and that drops the side effect.
It's surgically implanted. What's the downtime for that?
So maybe from 7 days to 2 weeks. And that's only from the incision site that you may have pain. But really, you should start feeling good relief from right away. And then sometimes you may need to adjust the dose, just increase it or decrease the medication to make sure that you provide the patient the best result.
Yeah. And it's cool because you refill the medication every 2 to 3 months. Who is an ideal candidate for this?
So the patients who typically take the pain medications and they have failed the conventional treatments and still they are in pain, and also the patients who are intolerant to the medication. So they get a lot of side effects. Those patients are good candidates for the medication. A lot of the cancer patients, sometimes they are in so much pain and then they don't want to spend their time with, in the hospital. They want to spend their time with family. That device can provide those patients a good relief.
Relief on so many levels.
That's true.
Dr. Narizi, thank you so much. He'll be here until 6 o'clock tonight if you still have questions. Call 858-2222.